I am Dr. Govardhan Ingale. I am a pediatric orthopedic surgeon working in ONP. For past few days I have joined this institute. I deal with the problems which starts with the birth, the baby. There are congenital problems, or there are few problems which comes during the development of the child. During birth, many times we get the kids with club feet or developmental dysplasia of the hip, cerebral palsy, etc. And we deal with them. Most of the problems in children what we see routinely, they are developmental problems. Like during their development, the bone get deformed, or they may not have proper nutrition. So many kids we do get with rickets, etc. Or some are the congenital problems which are there since birth. Dealing with them is bit tedious actually, but we are trained in it. I am fellowship trained guy, and we know the problems, we know the causes of it, and we can definitely give them a very better and good solution for their functional and better life. I would like to share one case with you. There was one girl who was, when I operated her, she was 13-year-old. She never walked in her life. She was suffering from meningomyelocele with dislocation of her both hips. She had been to many consultants previously, but the answer was not given to her properly, or maybe she was not got that kind of treatment which the parents were expecting. When I first saw her, I examined her, I got few investigations done, and then I told her that yes, we can make her stand, we can make her walk independent. That time at the age of 13, the kid was almost 70 kg weight. So you just imagine the mother and the father, they have to carry their child everywhere, to the school and everywhere, you know. It was really a burden for the family, and the child was very enthusiastic. That girl told me in the first time, doctor, please make me walk, whatever you can do. Fortunately, I did surgeries on her, multiple surgeries, almost 3 to 4 surgeries that time. And right now she is on her feet, she is walking independently, and I am very happy to share with you that she has completed her graduation also now. And now she is going for postgraduate studies, and she is driving bike, she goes alone everywhere. She is very happy kid now. She has given me special thank letter and whatnot. The parents are very much happy because of her progress. I am very active in our academic field. Every doctor or every surgeon has to retrain himself, you know, train and retrain. That's what we believe. And fortunately, I was the secretary of Pune Orthopedic Association, as well as I was an organizing secretary for last year. I organized Maharashtra Orthopedic Association an annual conference, which was a huge grand success. It was an academic conference, and I was an active faculty into it. I was an organizing secretary for that conference, and we keep on attending most of the CMEs, that is continual medical educations, which is happening around the world. I participate into it as a faculty most of the times, where we deliver lecture, we teach students. Also, we learn from them, we learn from our seniors. That's how we are getting recent trends in our practice, and we are trying to help our patients. For any emergency which comes to ONP, it's a first priority. Whatever our regular work is going on, that we try to suspend for time being, but we manage the emergencies. And I am very happy to tell you that we have very able staff here. You know, in ONP we have very able staff. They take care of the patient. They just need our consultation, they just need our guidance, and then they carry on other things. The procedures or anything what we do, but patient care is very good here. So we don't have to really bother about it a lot. But we do get this situation when both things are together, but we manage it. Actually, we are using, in pediatric orthopedics, there are many new things which are coming in now. So one of them is botulinum toxin for cerebral palsy, then titanium nailing for the fractures, long bone fractures in children, then growth rods, then spinal instrumentation is separate for the children, as well as the 8-plate, that is a temporary hemiepiphysiodesis system, which can, you know, make the deformed bone or the crooked leg straight. By, you know, we can stop the growth temporary of the bone, and we can again start the growth. So that is a very recent things which are in. Basically, the deformity corrections and lengthening procedures which are having new implants, new instruments with us, like magnet system, where the nail can be expanded in a bone from outside remote control. So that's something new which is coming up. Like similarly, like for the spinal deformity, if we for scoliosis correction, the rods which we use, they can be lengthened from outside without doing a surgery, just with the help of a remote control. So the bone growth is maintained as well as the deformity is corrected. Any doctor, the social responsibility is must, and I'm happy that I have been a part of most of it. Like I had operated more than 600 kids in Sarva Shiksha Abhiyan, which was driven by government, and I was active surgeon into it. Similarly, we have to make awareness camps for these problems. So that is what our social responsibilities are. I will really like new young generation to come with us and share their experiences as well as join hand with us, because it's a really need of the time. If we think previously 15-20 years back, any child with a disability or a problem was thought to be because of a curse or some other things, like the social stigma was too much. But now we know the answers, we can treat these conditions. So I feel if we think that patient is going to survive for another 70, 80 years, so how his life is going to be. So if you can give him a functional and better life, that this is the chance. So I really invite most of the freshly passed out students to please join this pediatric orthopedic also.